In 2012, the New York Times published an incredibly powerful story about how a father angrily walked into a Target store holding a handful of coupons for pregnancy-related items like baby clothes and cribs and maternity wear. He demanded to speak with the manager and yelled at the manager, "My daughter got these coupons in the mail. She's just in high school. Are you encouraging her to become pregnant at this age?" The store manager was obviously confused, having no idea what the father was talking about, but he profusely apologized. About a week later, the manager called the father to apologize yet again, but this time, the father was the one that apologized. He had gone home after the previous exchange and talked to the daughter, and it turns out his daughter was pregnant. It just happened to be that Target had somehow figured it out before the family did. You see, what had likely happened before this was the daughter probably went shopping at Target, and based on what she was picking up from the aisles, set off an algorithm that Target had developed, which analyzed about 25 items in the store, when picked together, assigned each customer what they called a pregnancy prediction score. And not only would that score be assigned, but the algorithm could predict each customer's score and due date to within just a few weeks so that they could send coupons tailored to that. With this effort, Target took something incredibly benign, like shopping patterns, and turned it into something incredibly valuable: personal health information. I give you this example to highlight the power of data, innovation, and technology, especially when applied to something as important and sensitive as healthcare. But it doesn't all have to be so scary. In fact, I believe that technology, especially with the advancements in artificial intelligence now, is going to lead us into a new generation of healthcare, one which we can take a lot of benefits from in three main ways. The first is in the world of prevention and diagnostics. We all know someone that requires healthcare, or one day will. And we all also realize that the best cure to a disease is preventing it in the first place. And now, thanks to artificial intelligence tools, we can do that. Take, for example, breast cancer, which, caught early enough, has a nearly 99% survival rate. But wait just a little bit longer till it spreads to the local lymph nodes, and that 99% becomes just 33%, a 2/3 higher chance of dying. New advancements in artificial intelligence have given us an opportunity to be better preventers of disease, especially after models have been trained on millions of data images and radiological studies and patient follow-up from those studies. There's a great opportunity to become much better at prevention. Take, for example, the humble chest X-ray, which for decades has been used by physicians to give a very basic idea of just cardiac anatomy. Well, thanks to new models, chest X-rays can be used for a lot more now, such as diagnosing diabetes early on, understanding a patient's cellular or biological aging, and even predicting a patient's 10-year risk of death from heart attack or stroke, all from an inexpensive chest X-ray. They say the eyes are the windows to the soul, but now, new models have made them windows to much more. Retinal images can now show there's a prediction of kidney disease, gallbladder disease, or even liver disease from a simple fundal exam. Even brain MRIs can now be used to diagnose Alzheimer's disease years before it could happen. Or even think about ways in likelihood of neurodegenerative disease and paralytic conditions such as ALS. And perhaps most astounding, models can actually detect traces and indicators of psychiatric conditions such as depression and anxiety. All of these involvements would have never been thought possible just years ago, or just simple radiological images. Therefore, although artificial intelligence may not be able to solve all of our problems, it can give us a fighting chance to fight disease before it emerges. My next thesis is that artificial intelligence and technology will significantly scale human capabilities. One of the most astounding aspects of modern healthcare is the development of modern drugs, which has significantly improved life expectancy globally. But developing a drug is not an easy task. It takes years and decades of research by scientists to figure out the exact configuration of a protein and the shape of the target area, and then they have to develop a very specifically type of protein and shape protein or drug molecule to be able to fit into that shape. This takes years because it's like trying to find the perfect key for a very specific lock, except the lock is constantly changing on you, and there's an entire universe of keys you can choose from. New protein-based LLMs, large language models, can now predict protein shapes in the body to an incredibly high degree of accuracy, which means it gives scientists an opportunity to do what used to take them years or even decades to figure out these shapes, to build drugs targeted exactly towards the shapes that these models predict. What used to take them years is now taking them a matter of months. This significantly accelerates the drug discovery and development process, which means that years from now, it will no longer be a decade-long process to create a new therapy, but soon, just a few months, to target a new disease. Beyond just medications, AI has the capability to aggregate information about a person from a variety of different sources: smartwatches, genomic databases, electronic health records, and even shopping patterns, and bring them together in a way to replicate a person in a digital format down to the cellular level. This is called a digital twin, and it's being done all over the world today. But why is a digital twin useful, someone might ask? Well, imagine if you had a patient with a severe or chronic disease, but there was an experimental drug that just hit the market that could potentially cure them. Imagine if a physician could test that drug out on the digital twin version of the patient, rather than the patient themselves, to see how they might react. This could be a huge boon for therapeutics. There are actually companies now developing digital twins for patients admitted into the ICU. The idea is that the twins are updated with real-time information from cardiac monitors and hospital systems, but with AI overlaid on them, they can actually predict complications such as cardiac arrest or other tough things that happen in the ICU days or even weeks before they happen to the patient, which means the physician has an opportunity to intervene on the real patient before something happens. The entire field of organ transplantation is supposed to be disrupted with digital twins. AI can actually create a twin model of the delivered organ and the recipient to run millions of parameter matches to see if it's actually a good fit, potentially preventing the millions of post-transplant rejections and complications that occur every year. Therefore, this is the power of AI, being able to aggregate information from sources that are completely unrelated to scale human potential. My final thesis is that artificial intelligence and technology in healthcare will significantly improve the day-to-day healthcare experience for all of us. Right now, what we're seeing are a bunch of random applications and AI use cases, and the burden is on us to figure out how to learn these applications and use them to benefit our lives. But soon, AI is going to become so personalized that it's going to learn about us and our routines so that it can suggest to us how it can provide the most value to our lives. Imagine if all of us had a personalized AI agent that we could rely on a day-to-day basis to help us with our daily routines. In the following example, we're going to see Tina, who's just a normal person, interact with her AI assistant, who's lovingly named John. John messages Tina and reminds Tina that she's due for a dental exam and asks whether she would like some help scheduling it. Tina says yes. John looks through the history and says that Tina actually rated Dr. Willow a 10 out of 10 last time, and Dr. Willow happens to have 11 a.m. on Tuesday open, which is also when Tina's work calendar is free. Tina, being a great financial steward, wants to check if Dr. Willow is still covered by her insurance. Assistant John runs a file and says, well, based on the current information from Dr. Willow's office, she is still covered by your insurance, but AI John will automatically send a note to Dr. Willow's office just to make sure nothing's changed. Now, if the encounter stopped here, it would still be amazing, but AI assistant John goes even further and anticipates that Tina's probably going to need a ride to the dentist's office. And hey, she hasn't been there in a year, which means she's probably going to need to do some new paperwork. So he will automatically set up an Uber for her and ensure that she arrives 20 minutes early. AI assistant John also recognizes that this is over the lunch hour on a working day, so he's going to place an order for chicken noodle soup from Grain Market, which Tina always seems to love after dental exams. John is also going to send a note to Dr. Willow's office and make sure the pharmacy information is updated, because again, she hasn't been there in a year. And finally, he's going to send a follow-up note to the pharmacy to make sure that that evening, any medications that were prescribed to Tina get delivered to her on time. Now, with this encounter, over the course of maybe 5 to 7 text messages, Tina was able to schedule an appointment, make sure that there is insurance coverage, get a ride arranged, take care of lunch for that day, update pharmacy information, and make sure her medications were delivered. If not for this encounter, each of these individual tasks would have taken Tina a significant amount of time. But thanks to AI John's automation, a lot of that burden was taken away from Tina, and it was personalized. This is the future of artificial intelligence and personalization of healthcare technology for your experience. Intuitive, anticipatory, and teachable. These are the systems of the future. And the good news is that this technology is not decades or years away. It's happening right now. And as the cost of compute goes down, the cost of these systems go down. Soon, it will become so affordable that everyone in this room will be using something like this. It will become mainstream. Now, of course, there are many risks to artificial intelligence and technology in general. And at the end of the day, it's all run by machines. And machines can never replicate the healthcare experience that humans go through. After all, they don't understand the fragility of decision science or the emotions that often take place whenever you're going through a healthcare event. At the end of the day, there is something very uniquely human about the healthcare experience. Nevertheless, as I've described above, there are significant benefits that AI and technology can provide for day-to-day healthcare experiences. Therefore, society needs to ask the question, just because we can, does that mean we should? And if so, it's just a matter of thoughtful development and thoughtful execution. You see, for decades now, healthcare has been about limitations. Limited access to resources, limited access to education, limited access to knowledge, limited access to funding. That's all we hear. But I actually believe that artificial intelligence and technology in healthcare is going to usher in a new era, an era of abundance, which will welcome more of us to take control of our own medical journeys and understand healthcare much better than we ever have before. Therefore, my fellow innovators, I leave you with this charge tonight. Let us not fear this technology, but instead, let us embrace this new generation of abundance to lead forward society in a thoughtful and meaningful manner. Thank you so much.